Hello everyone, this is Dr. Adam Stewart from stewartmedicine.com. Today I'm just going to show you an example of the diabetes package of EMR tools that I've developed. It's essentially a toolbar mixed in with a complex encounter assistant, mixed in with a whole bunch of stamps, reminders, and searches and things like that. So this is a fake patient chart, and I'm just going to collapse the profile for the interest of screen space so that we can see things easier. And the toolbar here that I'm going to focus on today is this diabetes one, right there. There are a number of buttons that we'll get into, but one of the first things, let's say a patient comes in and they are prepped by the staff or a nurse or your patient usher. So that button there, just as you saw, brings in a stamp that the patient, the usher can quickly enter vitals. So let's say you have 132 over 78, and maybe. So let's say the usher has quickly entered those numbers. Now, a few things here. You'll see that this unique string of letters here actually says patient had DM visit today. We use that as a tracking way to track diabetic visits and build searches and reminders off that. You can't really build searches off, say, billing codes, because if you have nurse practitioners seeing patients, they're not billing OHIP, so you need to have a unique way of doing that, and we don't use a custom form, so this is the unique way of just tracking diabetes encounters visits. And the neat thing about that is when you actually use this filter up here, this is a filter button up here, DM visits, that if you click that, it actually just filters out diabetes visits in the past. So this is a useful tool if you want to see just diabetes visits that you've had, or maybe you have a nurse or allied health professional or a dietitian or someone who's just interested in the diabetes visits. So it's a quick way to just filter out messages related to certain conditions. So here I'll just draw your attention quickly to reminders. This is for the people or the nurse or usher prepping the patient. This is a quick reminder to check with the patient to see if they've had their eye exam done within 1 year. If it hasn't been up to date, it will actually show up in the reminder box. But if they have, then it won't. And you'll need that up-to-date information for when we open the encounter assistant later on, and we want the most up-to-date data. For example, if a patient had an eye exam maybe a year and a half ago, but on our EMR, but they actually just had it a month ago or two, that the optometrist didn't actually send us a letter, we can quickly update that information. The foot exam is just simply to have the patient ready with their socks and shoes off, so that it increases workflow speed, so we're not waiting for patients to take their shoes off at the time. And we have reminders built to remind them if the foot exam is being over a year old. So the usher leaves the room, and then this is where I would come in the room, and I would open up the chart again, and this is the DM encounter assistant. So this is what I would open up, and it's a fairly large encounter assistant, but it actually things go by quite quickly in the actual workflow of a visit. So quickly here's a button that shows, well, first of all, it's automatically imported some information for us: last A1C, the date, and the patient's individualized target, which we have set up to track individualized targets per the new CDA guidelines. So either here or even up here, we'll graph the A1C. So if I click that, it graphs the A1C. That's quite an easy, good feature. Now, if I bring my mouse down here, a feature that people might not know is you can actually see what medications people were on at the time. So you can see down here it's bringing in what type of medication. Now, another thing you'll see from the toolbar is I've actually had, for any patient with diabetes, we're actually bringing in the patient's most recent A1C just to see at our fingertips. But that actually is a button that does the same thing. It graphs the A1C. So a neat little feature there. So we can quickly scroll down and see if we wanted to change the patient's target. There's a drop-down menu box to do that. How often they're checking their sugars. Maybe they check them 4 times a day, or maybe just twice a day. Did they bring their logbook or not? Often not. And then so here's just a free text area that I use to say, AM sugars are usually 7s, you know, suppers, 10s, for example, or whatever other free text note you want to make there. Noting whether or not the patient has hypoglycemia. If so, I've got a free text box down here at the end for of every section that often things don't fit into click boxes, yes or no. So, you know, having lows middle of the night, and then you would explore that and just type a quick note. This is an area you can freely text whatever things don't fit into neat little check boxes and that. Come back to this insulin button in a second. So if I wanted to have handouts at my disposal for patients driving, maybe they need a reminder on driving, just clicking that quick will open up a handout. Sorry, it's outside of my screenshot here, but so quickly with the quick button, handouts are at your disposal. Another one for highs and lows. I've also got that up here in my toolbar, so even if the counter assistant isn't open, I can simply have those handouts at my disposal. If we wanted to refer to our dietitian for say dietary advice, we have custom forms that insert for our own diet inter-referral diet allied health professional referrals. So there's ones for foot care and dietitian and social work and things like that. Now at the end, if I click this box here, when I click for messaging the AHP, that's the user initials of our booker who books our allied health professional into referrals. When I click finish, there will actually be a auto-populated message that notifies the booker to book the appointment. So very useful for saving time that way. If I use this button here, it opens up an insulin box that was hidden before. The great thing about Encounter Assistance is that whatever you don't fill in won't get printed into the final note. So I just have my standard common insulins that I use right here, and I can quickly document their current dose. Maybe it's changed since the last time. Maybe they've adjusted. Maybe they're they're on 555 or something. And then if I'm making a change, I can make little notes here or whatever have you, or change to 444, things like that. Some standard device to watch for those that I always tell people, and just some standard documentation there. You can just delete that if you didn't talk about it, or keep it or amend it. Here is the neat thing. If I can send letters to patients. So often when you're running by insulin instructions, you're running a whole bunch of things by patients that they don't take in all at one visit. So it's good to have a handout or some written instructions at the end. So what I have here is I've got some letters to patients that are stamped in automatically. I've got two options here, but let's just say option A for a second. So if I click that, it actually addresses a letter that I can print off to the patient, and it's a stamp. So some default. Let's say I'm going to keep the Lantus dose the same. So I'm not going to keep the Lantus or adjust the Lantus. But so if I can just delete that, but I'm going to just say the breakfast dose, or I could change that to lunch or supper. So. And let's say there are no rapids, so I might just quickly type over that. But in any case, the big thing is I can say, well, let's jump up your units to 12, and then it gives you the standard device to slowly titrate up until your lunch dose is in the 4 to 7 range, or 5 to 8, or you can retype whatever you want, and some standard device for watching for those. So with a control P for print, I can quickly print that off, and the patient has some take-home advice right there, and it's documented in my chart, the advice that I specifically gave them. That's a really big time saver. Next section, blood pressure, same type of thing as the A1C. There's a graphing button here that I can quickly see, or up here in my standard toolbar, I have everyone's most recent blood pressure showing, but it's also a button that graphs the blood pressure. Sometimes here's some standard options that I might do. I want to continue current management, or maybe I want to refer to my Allied Health for my hypertension diabetic program. That messages the Allied Health the same as that button did up there. But or maybe I want them to come back for a couple blood checks times 2 in 4 weeks, type of thing. And again, standard text boxes for free text areas for things that don't fit into boxes. So when we get onto the lipid calculator, I'm adapting the new simplified lipid guidelines per the CFP 2013. But so I don't really follow LDL so much anymore, but rather I go by cardiovascular risk calculator, and this can apply to not just diabetes but across. Aren't familiar with that? It's a great little web thing that you can bring up even with your patient, and you can enter in risk factors, male, female, and it shows their risk calculations. And then at the bottom, you can enter in, how much benefit does a moderate intensity statin give them, relative risk benefit, but then it can show you in smiley faces and happy faces what the risk is. In any case, if you're going to go over that in a visit, which you don't often have to go to, but maybe once every year or so, maybe reassess that, you can then enter in the number from there and track that. And there's some standard options for monitoring cholesterol. Maybe they're already on an appropriate dose of statin, or maybe the patient doesn't tolerate, or maybe you've had this discussion. This often happens that the patient just opted against having a statin, knowing the risks versus benefits. Body mass index, here you can quickly graph that. Up here as well, you've got weight, BMI, and weight circumference, all of which are showing their most recent values, but they're all buttons to graph the most recent values. Moving on to kidney function, sometimes the lab when you bring up a lab table, the whole lab table is too many values to see at once, and you can't really pick out the quick renal values you want or the specific ones. So I built a flow sheet that just brings up the relevant kidney function blood works, and from there you can even graph the buttons with the click of a button. From there, say graphing creatinine or EGFR just with the click of a button. This same thing over here, the same button is available up in here. I display the most recent EGFR of every patient in the general toolbar, and just brings up the same thing. Some automated values brought in here. Here is the search. This is a search applying, is the patient on an ACE or an ARB? And we will see here, yes, because if we go back to there, we can see they're on cover. So that's just without even having to open my med list or not, I can see, are they on an ACE or an ARB? And should they be on an ACE or an ARB? Well, this here opens my web browser to the diabetes guide, CDA guideline website, and it has right to the algorithm that I can quickly enter in the things in it. It will tell me if they should be on a statin or not, or statin, aspirin, or an ACE/ARB. So right at your fingertips there. This same thing opens, this button opens the same website to the same for looking at should they be on aspirin or not. And these are searches that just bring in automatically, are they on aspirin, Plavix, or an anticoagulant. Eye exam, it's bringing in your last optho or optometry exam to show, and if something was overdue, say an eye exam, this reminder box would actually be populate with the reminder showing. So as the tooltip text shows, when I hover above, the reminder only shows when it's overdue. So if it's blank, it's up to date. If it's showing, you need to remind them that they're due for eye exams. Same with things like foot exams too. If they were due here, it would show up in here. And if they are due, then I would open up this box here, which opens up my more specified foot exam. And I've got their foot risk documented, either high or low. And if I want to give them a handout on foot care, I've got this button here, just brings up my foot care. Just minimize that a little bit so you can see it better. My handout here for foot care. Similarly, that handout is also available right up here in my handout section. So going down here, this is automatically showing me if they're a smoker or not. If they are a smoker and I want to maybe discuss quitting, or maybe I want to refer them to my lung health program, which is another program we have for allied health. So similar to the dietitian referral, if I click this or not click it, if I click it, when I click finish, it'll bring up messages to book those referrals to the AHP booker. Immunizations, this is bringing up reminders to show me if they are, when it was last done and if they're due. Glucometer, if they're using it or not, and when their last glucometer check, I've got it set to automatically bring that up. And again, reminder will show in this box if it is actually overdue, if say they're on insulin and using it or not. In the patient self-management goal, so this is a neat section that it's a diabetic report card. So if I insert this is a take-home message for the patient that gives all of it'll insert the diabetic report card. So right there, I don't know if you can see the whole thing, but I've customized it to bring in the relevant tests that we do. In layperson terms, what it means, their target, their A1C and their target. Must be a little glitch here that I need to fix for bringing in their automated target. The blood pressure, it's bringing in the automated ones, and some of them it's graphing over here. It's graphing some of these pertinent values over here. LDL, if you're following it, it depends what guidelines you're following. If you're following LDL, it'll print off. If not, still have to come up with a creative way to transfer the knowledge of the new simplified lipid guidelines as an overall cardiovascular risk rather than LDL value to the patients, but that'll come with time. Here, again, the foot exam, eye exam, it's telling them when they're due and when their last one was, their weight. Now here's their self-management goals that I was bringing in. So you notice that up here, so down here, goals from last visit. This was their goal, maybe walk 20 minutes 3 times per week. So up here, back in that encounter assistant, you'll see that it actually brought that in automatically. I didn't have to go search into the last note to bring it in or not. So maybe they did or didn't meet that goal. And then most importantly, I can put in their new goal. Maybe they want to lose 5 pounds. So when the next time I print this off, this whole cycle continues, that this would come up in their value or their goal from their last visit when I see them in 3 months from now. Back up here, some standard follow-up, non-fasting blood work before the next diabetes visit. I can then quickly insert my lab rec, and I even have a button here for my diabetic labs that will just quickly, with one click of a button, just click off all of the values that I want. And let's say I also want to check some basic LFTs next for some reason, or so I can click off that button too, and it adds in that for different reasons, or extended lights, and anyway, you can play with that and do all, or customize it to your liking. So at the end of this, I would click finish, and we've got a nice tidy note, and with it, that all the data is in standardized form that can be trackable from certain things. As I mentioned the first time, or earlier on, just by clicking finish, this is a button to the Allied Health, which I didn't have to go typing. They're already going to make the referral after, and that's it. You've got yourself a diabetes visit done.